to see my slides. So, like yesterday also we saw one slide, right? The menarche, menstruation, and menopause. These all are the stages of changes in woman's life. Like one small girl changing into woman, woman changing into a grandmother. The stages of a life of a woman. So whereas in menarche, she starts her puberty. She gets her puberty and she starts her first period. And in that period also somewhat like many physical emotional changes will go through in a girl's body and in life also. Later, after getting menarche, regularly she will start to menstruate. As we saw in before last class, what is menstruation, what all changes will happen. So that is menstruation. Those all changes till 30 to 40 years of age. She will be crossing these all stages. Later, last stage of a woman's life, especially the reproductive life, is menopause. So, as the name only suggests, pause. Pause means stop, right? Anything which stops. So, here what is stopping? The menstruation. So, overall, to like as I explained now, what all changes will go through the body in this menopause around 35 years, till 30 to 35 years, the regular menstruation will be taking place in woman's body and she will be having her regular fertility life, that is reproductive life. But once she crosses the 35 years, somewhat changes will start to happen in woman's body. That is, excuse me. That is like even without knowing all this knowledge, we can guess or we can correlate this with our mothers or any elderly women who are present in our home after ages, especially after 35 to 40 years. Simply they will be shouting for every silly things. They will be getting irritated for everything. Not only elders in home, even us, like who are almost nearer to 40 years, you can identify or you can correlate, like sometimes simply we will be feeling happy, like we got something gift, or sometimes we will feel unwantedly irritation or crankiness or the frustration. There will be nothing matter to get frustration, then too will be feeling like frustration. These all why we will be feeling, especially around 35 to 40 years. At that period, as they showed, the hormones, whatever were got aggravated, were got stimulated in the time of menarche, that is 9 to 13 years. When we start with the first period, we know, we got to know yesterday, right? This endocrine gland stimulates the hormones, and estrogen hormones start to secrete in our body, and it will create the ovulation and the menstruation cycle, right? These all hormones, especially which estrogen and progesterone hormone, begins to decline in our body. Due to this, due to hormonal imbalances, we will be feeling irritation, mood swings, everything. Same thing in even elderly women also. So this is 35 to 40. By your early to mid 40s, what will happen? These all hormones will start to shift. It will start to like decrease. Your body increases efforts to create viable eggs by signaling the pituitary glands to make more follicle stimulating hormones. So due to decline in hormones, our body will struggle to get ovulation, will struggle to get like maturation of ovum, everything. So estrogen progesterone ratios may be in flux. This is around 40s. Then around mid to late 40s, like after 40s, what will happen? Perimenopause. Perimenopause, what it is, in detail, we will see in further video, like slides. This will be stage of perimenopause. Here, what will happen? Now, you may notice some symptoms of like irregular periods, or maybe if they are getting periods also, like clotting may pass, or some may pass heavy bleeding, or some may feel like no bleeding only, less bleeding, reduced bleeding. These all. As the pituitary gland ramps up the FSH, other hormones loop may be affected, including your stress hormones and thyroid hormones. So these all will be changes again due to the hormonal imbalances. So this is around late 40s, and around 50 to 55 the menopause occurs. Menopause occurs means how? If she is getting or woman is getting irregular periods, it is not known as menopause stage. When any woman, she is not getting her regular menstruation cycle, regular periods regularly for 12 months. If she didn't get regularly, like 12 months continuously, if she didn't get her periods, then that stage is known as menopause stage. And also here, what will happen? Some women may experience like 2-3 months they may not get, again once they may get, again 2-3 months they may not get, again once they may get. That also won't like not considered as menopause. It will be considered under irregular cycles. But when a woman won't get uh, menstruation cycle regularly for 12 months, then we can consider it as a menopause stage. See, so these all changes will happen around 35 to 50 to 55 years in a woman's life or woman's reproductive system. So these overall is known as menopause stage. And again, it divided into several stages. What are those? We'll see. So as here they gave what we saw now, like menopause is the natural cessation of the menstruation and end of a woman's reproductive years. Whatever reproductive life was started in a menarche, it will come to end. That stage is known as briefly menopause. And at what age it may get? 45 to 55 years according to classics or according to real like bifurcation. But nowadays, as we are seeing fluctuation in menarche, early menarche they are getting, and in some cases late menarche, late puberty they are having. In same way, this menopause also has changed. Some women are getting even in 40s also they are getting menopause, and some women they are getting delayed around 55 above also they are going, but it's rare. But most of them they are getting like menopause around 40 years only. Again, why? Obviously due to our changed lifestyle and due to adulteration. And as I said, we have different stages of menopause, that is perimenopause. Before this we have premenopause also, perimenopause, menopause and postmenopause. So what they are in detail has pick also I added actually. Perimenopause is transition phase with the hormonal fluctuation. Perimenopause here is nothing but the only there is no any difference or affecting of a menstruation cycle, but only the hormonal changes are getting increased, which we saw around 30 to 35 years, 30 to 35 above. Hormonal decline of the hormones will start in a body. That stage is known as perimenopause stage. Here also they gave perimenopause, the transitional period that usually begins 4 to 10 years before menopause. When it will start? When the menopause is starting to occur in a woman, before that, before that age to 10 years. Like if she is getting menopause around 45 years, then from 35 years, she will start to have the signs of perimenopause. And what is this premenopause? Regular menstruation cycle and no menopause symptoms. Here, the hormonal imbalance starts to take place, but before that, it is premenopause. Premenopause means she is in a regular, she is in a stable life. That is premenopause. And in perimenopause, we can compare like initial stage of the menopause when the slowly hormonal changes will start to occur. And menopause is, to be in menopause, a woman must not have a menstruation cycle for 12 consequent months. As I said already, if any woman she did get her periods continuously for 12 months, then that period is known as menopause. At that stage, we can say that women attain a menopause. And what is this post menopause? Over 1 year has passed with no menstrual cycle. When she didn't had many menstrual cycle for 1 year, like continuously for 12 months, that is 1 year, then she attained menopause. After that, whatever ages, whatever days are there, those are known as post menopause. In this stage, what will happen? Like whatever due to hormonal changes, whatever signs symptoms the woman was getting, those all will get declined. From here, from above 35 years till she gets menopause, the woman will go like many changes she will have. Maybe like physical changes, emotional changes, mood swings, or especially the reproductive system complaints. It may be discharge. Further, we will see signs, symptoms. Those all she will suffer for almost 10 years, because as we know, the perimenopause fluctuation of hormones starts before 4 to 10 years, right? So all these years till she gets menopause, she will suffer a lot with the health complaints. After that, after getting menopause, after attaining menopause, almost like 1 to 2 years she will be continuing with the complaints. Later, after in this post menopause stage, she will become stable without any complaints. Again, she will be normal like before menarche. For this reason only we will say, right, like older generation people who are above 55 to 60 years, they are equal to children, we will say. Best example is here only, because after getting post menopausal stage, again her body will be pre to when she was before menarche, how the body was at that stage she will reach. So like maybe any reproductive changes will everything will stop, hormonal fluctuation will stop, everything will stop. But obviously we know like other age old complaints will start occurring at this stage. So what all physiological changes she will face in these these all 35 to 50 years? Decline in estrogen and progesterone levels. Obviously, these are main hormones for our reproductive functions, right? So these both will get decreased, reduced in our body. End of ovulation and menstruation cycle, because of insufficiency of these two hormones, there will be no ovulation and no menstruation cycle. Bone density reduction. Due to these all changes, there will be bone density will reduce. Because of this reason only, every gynecologist will advise one calcium supplement uh, when a woman occurs menopause, especially, or nowadays, even when the woman age of 40 years, when they reach the age of 40 years, they are starting the supplementary of calcium supplements for every woman's, because as we are nearer to menopause, due to fluctuation in hormones, due to stoppage of menstruation cycle, our bone density will reduce. Because of this reason only, you see, especially if you go for orthopedic hospitals, many elderly like old age people, we will see like they fall in bathrooms and they got fracture, or they were walking, they slipped, they fall and they got fracture, we will hear in older age people. But if you know there, especially the ratio is females will be more there in older age. If they fall and they get ill like fractures ratio is more in females compared to males in older age people. Because of this reason, after getting menopause, the body's bone density will decrease in woman's body. Because of this reason, they need compulsorily the calcium supplements. And changes in cardiovascular health. Obviously, till now, till the menstruation cycle, whatever the blood circulation was going through, and every month we were bleeding, our blood circulation was in good health. Though the pure blood is not bleeding here, then too, with the endometrium thickness, what sheds away, with that, some blood was moving out of our body, right? But after stopping this, even it may affect the cardiovascular health of a woman. So these all are the physiological changes in a woman's body. What all changes will happen when she is nearer to menopause or when she attains the menopause. So symptoms here, obviously, again these all symptoms vary. So only I added these like a pick, this pick, because has physically, emotionally, the main symptoms we can say hot flushes or night sweats, vaginal discharge or dryness or weight gain and slowed metabolism, mood swings, anxiety and depression, disturbance. These all are the main complaints, but we can't say only these complaints will be present, or we can't say these complaints will be absent. She may be having these complaints or not, but like almost 34 to 35 complaints, varieties of complaints we have, which we can't compare with each other. Like one woman may have only these complaints, another woman may have different set of complaints, another woman may have again different than these two women's different complaints she may have. Obviously it will depend on their lifestyle, depends on their routine, diet routine, activities routine, everything depends on their lifestyle and on their body prakriti. The signs and symptoms will vary, but the main complaints which almost women will face are hot flushes. Hot flushes are here nothing but like when they urinate or without urinating also, sometimes they will feel like, Mika, Mika, sometimes they will feel like something hot hair is moving from their vaginal part, or even while urinating, they will feel like some hot urine is coming out from their like genital part. They will feel those are nothing but hot flushes. And night sweat will increase more, like though everyone were are cool without any sweating or nothing, but the women will be feeling like severe hot hair is coming out from their body, or they are get they feel like they are get sitting around the hot fire, like this they will feel, and they sweat more. And vaginal, due to this hot flushes, they feel like vaginal dryness. Usually this sign will be even present in after delivery also. Vaginal dryness means no any discharge. Obviously our discharge was due to estrogen, right? It will stimulate the uterus and ovary, so they will move the discharges, or due to ovulation something. But here no ovulation, no estrogen, anything, right? So there will be vaginal dryness and weight gain. Due to these hormonal imbalances, the woman will gain her weight like very much without reason. Though she may feel like I'm not eating much, and even I'm doing activities also, then too my body is gaining weight. That will be due to hormonal imbalances due for their menopause. And sorry, slowed metabolism. Metabolism is here nothing but our digestion capacity, the digestive system's functioning. It will be slowed down. Due to these, again, they may get the like GIT complaints, severe gastritis or constipation or severe acidity. These all also they may suffer. And coming for emotional, obviously due to hormonal fluctuations, hormonal decline, there will be severe mood swings. As I said in first beginning of the class only, they feel like sometimes they feel very happy, sometimes they feel very sad, sometimes they feel simply frustration for everything they will feel. And anxiety and depression. Here, anxiety and depression is due to hormonal imbalances, one point, and another point is due to these all health complaints. They will feel like depression. Some like us, educated one, they will be knowing, some changes are going in my body, so I am feeling. But for village people or for unknown people, non-medical people, they feel like, why suddenly several complaints are I'm getting, or I'm suffering with several health complaints suddenly. Something happened to me. They will go into stress. So, due to that, they will get anxiety and depression. Due to these all changes and health complaints, obviously, they will feel sleep disturbance. So, as I said, these all are main complaints of hormonal changes and menopause. But with these, several other complaints also women may have. So long-term effects, those sign symptoms were due to those physical and emotional changes. But due to that, they may have long-term effect on one thing. Who may get long-term effect? When these all complaints started and they got to know, like they consulted a doctor, they got to know it's due to hormonal changes, and they started maintaining their diet, routine activity of life, everything in a regular basis. Then it will get into control, and they will get, once they will get menopause, they'll be all right, right? But in those cases, if they didn't maintain their health in a good way, then they ignored, or still they had the adulterated lifestyle only, though the such people, such women may go into osteoporosis. Osteoporosis here is nothing but one of the bone, as we saw, bone density reduction will takes place. So one of the bone disease, osteoporosis she may have, or increased cardiovascular disease risk. Again, we discussed, due to menstruation cycle, our blood circulation was in good way. If she stopped menopause, like if she stopped menstruation cycle, she may have some cardiovascular system diseases, changes in skin elasticity, because again hormonal imbalance will takes place, and due to that, especially GIT complaints will start. Due to that, she may have skin problems or skin elasticity changes, and urogenital atrophy. As we got to know, there will be vaginal dryness or hot flushes from the vagina. If they neglect, or in our Ayurveda, it will be due to vitiation of Vata dosha. So at that time, they should go through the some Vata dosha treatment, which balances the Vata dosha. If they didn't go through, then it will increase, and it may create the urogenital atrophies. Because at this period, what will happen, due to that elasticity, or especially the vaginal muscles elasticity will lose, it will lose its elasticity, vaginal muscles. So they will feel like, you may be here, some women will complain like, if I get urine pressure, I'm not able to control it. Sudden, I need to rush to washroom, I'm not able to control the urine pressure, right? It will be due to vaginal muscles elasticity, they will lose its elasticity due to that. So at that age, obviously, as we saw in yoga asanas, like especially like a butterfly exercise, if she do, she may retain her elasticity, or she may balance, mm, she may balance her elasticity of vaginal muscles. So if they neglect, if they didn't follow anything, then they may have urogenital atrophy also. So management, what we can do, that is, like as we got to know, these all changes will happen, hormonal imbalances will happen, and her emotional changes will happen, and we came to know that these all are normal one. Like these all changes, whatever she is having is normal. Due to her bodily changes, according to her age, she is getting changed. But though this is normal changes in her body, but we have to uh, give some supplementaries, or we have to maintain her health in a good, in a balanced way, so that she will not go for long term risk factors, right? As we saw, the like these all are symptoms, and long term effect when she will get, if she didn't maintain these all signs and symptoms in her body, right? So what we have to do to maintain her all complaints in a regular way? Lifestyle changes. What all we can do? Regular exercises again, has example I mentioned. If they do butterfly exercise, they can retain their vaginal muscles capacity or elasticity. Likewise, even pranayama we have to maintain our stress level, or like pranayama, anuloma, viloma we have, or we can do meditations. Likewise, any activities, nothing like they are not able to do any exercises, activities, or yogasanas. Simple thing, they can go for fresh air walking. It may be early morning or evening times. If they go for a long walk in a open air, their mind will get relaxed. Due to this, obviously stress hormones will decrease, and due to that she can maintain her health somewhat in a normal way. Or another thing what our doctors advise is social mingleness. It may be friends or any social activities if they like, or like outside. If they go out, their mind will change, so they will distract from the complaint, so that they can reduce the stress hormone. Because what will happen if they are sitting in home only, though our complaints will not reduce, because it is pathological changes are going through the body, so she is having, once she mingle with the outside social activities, she will forget the complaints in her, and she can reduce the stress hormone, and by that linking one other another, she can reduce the complaints. And balanced diet rich in calcium and vitamin D. As we got to know, the bone density will reduce its functioning. So due to that, the vitamin D and calcium rich diet we should advise for such women. And stress management techniques. Obviously, stress management techniques are, as we discussed, yogasanas, pranayama, or changing, diverting their mind, anything they can follow. Medical interventions, hormone replacement therapy, that is HRT, non-hormonal medications for specific symptoms. So obviously these is when the woman is suffering, by connecting each other, the woman is suffering lot with the complaints which she is not able to tolerate, or which she is not able to do her routine activity also. Then we will go for hormonal therapy, or else as we discussed, it's the natural process of the body. So no need to give artificial hormonal supplements, because here hormonal supplements means again, has there is decline in estrogen and progesterone level in their body, so they are getting complaints. They will go through this. They will give the hormonal treatment which increases the hormone, and their complaints will reduce. We should not do this, right? We are going against the body. So as far as much, they should avoid the hormonal therapy. Here, instead of hormonal therapy, I can advise that in Ayurveda we have particular medications which will balance the hormones. It will not increase or decrease, just whatever complaints the as I said, it will be purely due to vata dosha vitiation. So in our Ayurveda, what they will do now, to specify, to balance the vata dosha, we have some medications. But again, these medications depends on the particular body prakriti, particular complaints, and particular condition of a person. So blindly we can't go any, like which balances the vata dosha medicine, blindly we can't take it. Again, it depends. And so we can, if we consult a Ayurvedic physician, they will advise. So instead of going for artificial hormonal medications, we can go through the Ayurvedic medicines. Alternative therapies like herbal supplements, what they said, that is nothing but Ayurvedic form, or even home remedies, which are elderly persons, ancestors were following home remedies, we can follow. And acupuncture. Nowadays, this had become like a trending treatment, right? Acupuncture. Actually, in some point of view, this will work, because has they are the part, as in chakras we saw, particular areas to stimulate particular nerve system. Likewise, they show the some particular acupunctures, some particular areas which by pressing they will stimulate the nerves to brain and it will decrease hormonal balance, maybe stress level may be decrease. So these all are management therapies. That only in same way like I added in a pic, that is supplements, which are supplements compulsorily, excuse me, which all supplements compulsorily we should go through, that is calcium, vitamin, obviously we need. With that we can go through like other multivitamins or the in the form of medicines maybe, or in the form of diet, or in the form of nutrition supplements. We should give all multivitamins to balance their healthy diet. And hormone therapy, as we discussed, and non-hormonal medications are nothing but antidepressants or sleep medications. These all medications, these all are due to their hormones level decreasing. As we saw, they will be having sleep disturbance, they will be having stress level more. So due to, according to their complaints, we can go through, because due to hormonal imbalances and due to anxiety, they will be having sleep disturbance. If they did have sleep, again due to no sleep in they will be having other complaints. So instead of going one to one linked other complaints, they can have the antidepressant tablets and they can have good sleep. And for these also in our Ayurveda, they will say like we should do Padabhyanga and Shiro Abhyanga, head massage with oil and foot massage with oil, warm oil, indirectly heated oil, so that they will get sleep. Instead of going for medications, we can try this method also. And lifestyle changes, as we discussed, physical activities is must and should, breathing and relaxing exercises has like our pranayama, anuloma and viloma, access abstinence from smoking, limiting drinking, Kegel exercises, healthy eating, wearing loose, like as they will be sweating more, so they can wear loose cloths, layered cloth at night, good skincare practices, social activity, and counseling. This part is main thing. Counseling, if counseling and the family support. If, for example, as I said in initial, like we will think, why my mom is shouting so much, or my any elderly persons who are elder one in home, which are in this stage 40 to 50 years, we will think like why they are shouting, and once twice we will think, and third time what we will do, we will shout on them, right? Why you're shouting for everything? We will start to fight with them. Instead of doing that, we can support them. We should understand their age group, and we should under, like they are not doing it wantedly, right? We should understand them and we should counsel them. That will create much more positive vibes in their life or in their mind. So due to this social support, they will feel somewhat cool, and other complaints also will reduce. And another thing is counseling. If they are taking more stress that why I am suddenly I am getting all these complaints, what something happened to my health, they will go in a depression, right, by thinking. So instead of that, we can counsel them. This is the stage. As we saw the counseling in menarche stage, by explaining the girls what all changes they are going through. Likewise, in this stage also, if they are not able to understand what changes they are going, we can counsel them, and obviously it will be for 4 to 10 years duration. Once they get menopause, they will be all right. So we can counsel them. By counseling a person, many complications we can avoid. Example, going into depression or sleep disturbance, these all we can handle by doing counseling to them and giving them social support in the home.